Physician-assisted suicide. So, how is eligibility determined for physician-assisted suicide? Though each requirement may vary state by state, they generally follow the same requirements, meaning that each patient must be at least 18 years or older and have a terminal illness, meaning they have less than 6 months left to live. The patient must have the capacity in order to make medical decisions and should be assessed for capacity. A physician must also provide all end-of-life options for a patient, as some patients might not know the entirety of all their end-of-life options. It must also be voluntary and under no coercion by anyone else. Lastly, the patient must administer the medication by themselves and not by a medical practitioner. So, how does it work? After the physician has determined that it is voluntary and the patient has capacity, is a two-step process. First, the patient will need to take the medication beforehand, so that way they don't have any vomiting or any kind of nausea. Next, they'll take something called barbiturate, which will then mix with water and drink. Shortly thereafter, the patient will fall asleep and then pass away. So, who might benefit and who might be harmed from this? Patients who mainly benefit from physician-assisted suicide are people who want to decide how they want to die or in very severe pain, as patients want the right to control the way that they're going to die and do want the disease to take that from them. Also, patients who are in horrible pain that they cannot control very well may also benefit from this. People that may be harmed are people who are most vulnerable and often feel death is their only option, as people are asking for physician-assisted suicide may be poor or poverty-stricken, feel that this is their only way out. Also, people who have been coerced in participating in physician-assisted suicide. So, what are the risks of having these types of laws? The risk of these laws often breaks down to individuals being taken advantage of, unfortunately. Some worry that insurance companies may deny treatments in favor for these. For example, if they have a type of life-saving treatment, they might deny it, and they might end up approving this physician-assisted suicide type of treatment. So they might end up prioritizing the death of their client than trying to prolong their life. There's also the issue of people being misdiagnosed with a terminal illness, as people may think they might have a terminal diagnosis and jump straight to this when they might not actually have that terminal diagnosis. And people are also worried about these laws being abused and possibly overdoing it. Like I talked about earlier, how some may not know their entire options and they might just end up overdoing it on these types of laws. So what laws could be barriers for these types of patients? Well, the Supreme Court did rule that it was up to the states to decide if this was legal or not. Many states still do not have any of these laws, and only 14 states have made it illegal, which means that for many patients, it's not a viable option as it's illegal or just not available. So, what laws could be put in place to protect against these negative consequences that I talked about earlier? Though there are already some laws that are put in place to protect any accidents that may happen. For example, there is a rule that requires two physicians to proceed, one being the main physician, the other being the consulting physician. They check for the correct diagnosis or check and see if the patient has the capacity in order to make medical decisions, and both physicians need to sign off on that. The patient also must be provided with full informed consent, meaning that they received all available options for the end-of-life care. The patient also at any point can decide not to take the medication or opt out whenever, even if they've already given their consent or maybe even have the medication with them. All right, here are all my references, and thank you for listening.